Hey guys, Crew Blind Way back. I'm Aaron.
I'm Melanie.
And we're back with the Pitt. Last time on the Pitt, we were dealing with some intubations.
Yeah, double intubation.
Mm-hmm.
One guided and one guided with the camera.
We met Jake. We talked a lot about building trust and almost building relationship and kind of building the community aspect, I think, of the hospital and getting people to trust you and want to work with you so that you can better provide for them, which I thought was a really nice message overall for that episode.
And not just going in and being like, where's the social worker?
Yeah. We have some issues with an abortion going on. A mom showed up. There was a mom already there, but that wasn't the mom. So there's another mom who's the actual mom who's momming.
Well, there's also a nurse that had the best sex of her life.
That's not the important part.
It was under a
related
blanket.
to Jake. There's the Rita left Ginger maybe. So we're waiting to see what happens with that. But I think for the most part things are kind of calm.
Don't say stuff like that.
Mom, stop! This is what you had in mind for your fun weekend with your aunt?
Realize you just paid $500 to throw that in there.
Scalpel is telling me that my daughter is pregnant. I don't want to be a teen mom. Well, then maybe you should have thought of that before you started having sex.
Okay, emotions are running high. I think a private conversation between mother and daughter is in order. Lynette, let's you and I step out. I'll buy you a cup of coffee.
Crashed ambulance leaves are en route. ETA 10 minutes. Trauma 2 is all yours.
Great. They better be meth head junkies, because Abby wants a Birkin for her birthday.
What can do with the Birkin?
Hopefully forgive me for getting the kids a golden doodle.
Oh.
That's why you used to want a dog earlier.
How's Travis, our tonsillectomy patient?
Oh, I just dropped him off at surgery. He's doing well.
He's got black
Good
scrubs
work.
now.
You kept him from bleeding out.
Oh, no, come on, that was all you
Yeah,
and
where did
Dr.
he get
Robbie.
those from? Oh, he went upstairs.
Christy should make her own decisions.
Unfortunately, she's still considered a minor. Why don't you take a seat and we'll come find you if there's an update.
Oh, a ministration.
What do you mean, Robbie?
Escaping.
Dr. Rabinovich,
Gloria,
this is Dr. Tracy Morris, Regional Manager of the CQ America.
the contract management group.
It's a pleasure to meet you.
Everyone benefits.
Do they, though? Your contract management's corporate mandate is profits for shareholders above everything else, yes?
Robbie,
Your hospital's board was very impressed with ECQ's. How does regional medical director sound? Lighter workload, better benefits, stock
Bribing.
options. Hopefully we'll get a chance to work together soon, Dr. Rabinovich.
He's gonna blow.
I need you to improve scores with the resources we have, or we will explore what ECQ has to offer.
This is bullshit. You know this is bullshit, and if you don't, then we are all in
Maybe you
trouble.
need some time off.
Hey, we got a ladder fall. A couple minutes out.
Nice save.
So who won?
Oh, Doc Collins hit the full parlay. In our zone, crash, and frat boys.
That's uncanny. Bordering on spooky.
Dr. Collins? Which one's Collins?
I don't remember.
Oh. Dr. Collins.
Oh. Is this the ladder?
45-year-old Silas Dunn fell off an 8-foot ladder. Right chest hit the carpeted floor. No LOC, good vitals. No meds, no allergies.
I was a little dizzy.
He needs a head CT, EKG, and troponin.
Exactly.
On my count, 1, 2, 3.
I was installing a lighting fixture.
So he did not lift by the head. He supported the C-spine. Even though it looked like he was loose.
Gotcha.
I was gonna paint the living room next. My wife has a whole list of things she wants us to get done.
I'm afraid the only home renovations you're going to be doing in the next couple of weeks are the kind you watch on TV.
You tell my wife that?
I need a list like that.
What's your son? Scorpio?
So I can cut through.
Spicy?
Tier 1 trauma, ETA now. Tier 1 trauma,
Call me if anything changes.
Who all did we send up there?
Stolen ambulance versus tree. Lacerations to the anterior thigh from broken glass, otherwise no injuries. Good vitals.
You heard anywhere, Zach?
Where's my husband?
Oh boy.
There's 18, unrestrained driver of the stolen ambulance.
Ooh.
Unrestrained. So you didn't wear a belt?
No belt.
Can I go with him?
Is your friend?
He's my pledge.
We're going to find a room for you. Let us take care of
Only frat boys would be awake at 10 a.m.
Compressed centrally. Sternoclavicular dislocation.
It's compressing his trachea.
Reduce it. See if it helps his breathing.
Stabilize the leg.
No blood in the oropharynx.
Clavicle is dislocated posteriorly. Chlorhexidine swab. 10 of Lido with epi. Time is of the essence.
So every time they go in and they do all this,
Yeah.
they're always being like, BP's this, heart rate's this.
Yes.
Here's all this.
Yes.
Are they saying it just so that everyone knows? Is there someone on the side like writing this stuff down? Like, why are they saying all this stuff out loud all the
So
time?
the nice thing about these machines now, they also record them. So they will record themselves. We used to have to write them down, yes. But also knowing what the BP is, it's indicative of like what the current situation is. Like if their blood pressure was like 60/40, then you are dealing with something different than if it's like 200/90.
Sure.
So
okay.
it's just so then
Like different situation. So like, but like, they said the BP earlier, and they said the BP again. Like they've said it quite a bit. Like, is that usually fairly common?
so
Just to make sure.
you just
like,
keep recycling it, because if he's bleeding out or something, that blood pressure is just going to keep dropping. Right now he's tachy, which is his heart rate is above 100, but that's also because he's having struggles breathing because his
clavicle, whatever.
clavicle
they said.
is shoving against his trachea. So they assume that this is dislocated, shoving into here.
Because my initial thought was like, I mean, the blood pressure's right there. Can't everyone just look? But everyone's doing other things. So you're
Exactly.
whoever's looking is kind of trying to update everyone else to keep an idea.
So
of,
you
like,
just scream these things basically, it's just so then people can keep doing what they're doing. That's why, like,
is it one person or everyone's just doing it when they can?
so usually you have someone that's in charge of the monitor, because like they can't do other things. So this person that's here at the C-spine trying to make sure that he is keeping his head still in case he has any like spinal injuries or like neck injuries, head injuries, keeping all of that still is there at the top at the monitor where he can see it the easiest. So typically they would call it out because they're closest.
Okay.
But as soon as you have a finding, you say it out loud. That's why, like, kind of like in RAID, keep comms clear unless you have something important that you need to say.
Gotcha.
So
Okay.
it's all communication. Like, he's going to call out whenever he's has something sharp out, and if he's cutting into something. They have called out the lidocaine, which is also another sharp. Like, all of it's communication.
Okay.
So you have to work as a good coordinated unit whenever running a trauma.
I just wonder how, like, too, they don't talk over each other enough to where it gets too confusing or anything either. But I guess you have, like, as long as you know what your role is, these are the people that are communicating this, these are the people communicating this, then it gets a little easier.
Yeah. Yeah, exactly. Because usually, like, with the techs, they're not doing, like, their primary goal is to keep in control of the vitals, because that's the one thing that they can definitely do. Nurses are starting the IVs, they're starting to push the meds, they're starting to do everything within the current protocol, because there's already a protocol of things that they can administer
Sure.
without the doctor screaming those out. So they're already doing their current protocol. Same thing as like getting them hooked up to their 5 leads there, like to the cardiac monitor and everything. Like, they are doing everything, and anything that's different, they are announcing it.
Gotcha. Okay. I mean, you talk about RAID, which by the RAID, she was talking about like World of Warcraft, like RAID boss and stuff. But like typically in that, like, you don't have the DPS shouting out when to do heal stuff.
Yeah.
You have the healer groups doing that. Unless you have someone who's like really low and struggling, you're like, can I get heals? And maybe you have that. But that's more of a specific.
That's
kind of
like a
moment.
critical, yeah.
Yeah.
But then you have like your healer lead, you have your tank lead, you have
Yeah. And they're
someone yelling
communicating-
out mechanics.
They're communicating certain aspects, and it's not meant that everyone's supposed to be shouting everything. It's just these people shout these things.
Yeah.
So, okay.
Like you said, people have their roles that they need to stick to.
All right. No, I was just wondering. So I was like, man, they're saying a bunch of stuff.
Yeah.
And like, the monitor's right there.
No.
But okay.
There's no time, and sometimes people are standing in front of it, so like it's
Not everyone
better.
can see, or you're down here doing whatever
Yeah,
with
exactly.
the patient. And I guess if you're doing something and they're like, blood pressure just dropped 20
Exactly.
points, suddenly you're like, oh, damn. Maybe I shouldn't be doing this, or maybe I need to do it faster, or I don't know.
So that's why even if it's within normal parameters, you still call it out, so that they know that we're still
We're
in
still
a safe
good right now.
zone.
Okay. Okay.
I'm going to inject an anesthetic. You're going to feel a pinprick and a big
God,
burn.
why are there so many needles in this show?
Oh, and that's so full of air too. That's terrifying.
What do you mean it's full of air? Oh.
They didn't pre-fill the syringe with liquid.
Miles, it's gonna hurt for a second. You ready?
For a second.
Is he pulling the bone back up? Is that what he's... Oh!
Oh!
Good.
Screaming is good.
Yes, it is. It means it's cleared out the airway. He can breathe now.
You know you guys were on the news?
You stole an ambulance. What were you thinking?
It wasn't my idea. Does he look like a meth head to you?
Seriously, what is wrong with you?
Okay, Chanel, all set.
How bad does it look?
I'm
What's
gonna be
going
honest
on?
with you, it doesn't look great.
It's like
Thankfully, there's no
Clayface.
signs of infection.
I'm such an idiot.
What happened?
Excuse me, Dr. Walsh.
I'll be right back.
That's why knock. Shut the secondary curtain.
Complications from silicone butt injections.
So call the clinic and did it.
She found the guy on TikTok.
Oh.
He did the injections in his living room.
Oh.
She thinks it was maybe silicone cock from Home Depot.
Oh.
Oh.
She's tachycardic and tachypnic. I think it's a panic attack, but if a piece of silicone hit her vein,
fast
she could have a
breathing
pulmonary embolism.
and fast
We should
heart.
scan her.
Good.
So that tacky just means it's just it's accelerated fast. That's why tachyons are used for the flash. He's fast.
Any word back on Nick Bradley's cerebral perfusion test?
Still waiting on results.
What about Ipecac mom, Theresa Saunders?
Lung fluid
She's
should be
still
good
waiting.
to go soon. See, we do have patients that appreciate you.
That's the perfect time for Myrna to go by.
Hey, do you think they're gonna give us lunch? It's past 12 and I'm starving.
You can pack a bunch of these for your next shift, or grab a sandwich from the patient bin. There's no time for breaks around here. Wardrobe change?
They're a little
They're
short.
short.
But that's true. Like in our shifts too. Sometimes you got lunch, most of the time you did not.
The scrub dispenser was out of my size.
So it's a good look, Huckleberry. Show off those ankles. Aren't both
Dr. King is great. We have a
So
meeting.
we do a great job coming up with the right diagnosis and treatment plan for our patients, but there are still some opportunities for improvement.
This bullshit again. I do enough charting as it is.
The hospital won't admit this, but it's less about charting and more about profit.
Okay? Good. That's it. Goodbye.
Every piece of gauze you used, we need to charge them for that.
Are our pregnant teen and mom still talking?
Yeah,
We're yelling from that room?
not that I've heard.
Good, maybe it's working. Either that or they killed each other.
That's what I was thinking.
That they killed each other? Who needs an abortion whenever we can just kill them?
I need to check on my Nepali patient.
Nepali.
She likes me.
I like her.
Everybody likes you when they're on morphine.
Sorry, what are you doing here? Oh, I'm down to see a consult young man with a heart apnea. Can they come with? I'd be happy to do a little bedside teaching.
Oh, we have a 4-year-old. Yeah, I love that. Do you mind if I join? Maybe I can learn something new?
Sure.
Great.
I don't need anybody else associating me with my mom.
I know, but I just can't say no to a hot appy.
She's like, networking.
Tim, raise your right leg, please.
Oh. Psoas sign, causing friction of the psoas muscle over the inflamed appendix.
Excellent.
Did they do that one too? Whenever, seriously.
I also wasn't chilling playing games. I was like, ah.
Yeah, yours ruptured.
Honey, we discussed the study at home, right?
Honey? Wait, she's your mom?
It's Victoria.
Awkward. Ah, I hate cringy.
Mrs. Grant now has chest pain, if you'll excuse us.
Oh, yeah, go. Patients come first.
That was fake, right?
You just had that look on your face my son gives me when I give his basketball team pointers from the sideline.
Shut up, Mom! I know that look pretty well. Except I was the coach. I was supposed to give the advice from the sidelines.
Yes, I suppose.
Head and neck normal, but Tech found a small hemothorax on the right.
Oh, what's that?
That's a little bleeding around the lung where you broke a rib.
He's also been more short of breath since after the scan.
Is that from the pain? Silas?
Uh-oh.
I think you might need a chest tube.
Did she smile?
That's what she's been wanting to do this whole time.
She better not do it prematurely.
Prep for a chest tube, 20 French. I would love to do the chest tube.
You got it. I'll guide you.
Sacs are low. Should we intubate?
Until after the chest tubes, we wouldn't want to cause attention pneumo.
Again.
That's what happened before.
Do you want me to hold your hand?
No, don't touch me.
Focus on the chest.
Are you sure?
Fifth intercostal space, anterior axillary line. Perfect.
Oh, fuck, that part does. Jeez. Oh, God, I was talking about being.
That part bothers me too.
We're good. No need to hover.
Okay, I'll be next door if you need me.
And it's still there because you don't want to remove it.
Don't take it out. God, man. I would hate that so much.
And she continues. She does the whole chest tube anyway.
Okay. You're gonna pretend you're a pirate with your foot on a keg of rum.
What?
Are you serious?
Yep. This is the Captain Morgan technique
I
for
hate
hip reduction.
ortho.
Captain Morgan.
Who's Captain Morgan?
I'll stabilize the pelvis.
Okay, you're gonna step up here,
This one bothers me.
and you are going to use your leg as a hinge to put anterior force on his femur. Physics.
Push down on the lower leg with your left hand.
You got this.
Just popping it back into place kind of thing?
Yeah. I hate ortho so much.
Oh, she broke it.
Nope, it's supposed to do that.
It popped, and I was like, oh, God, she broke the hip.
We had to relocate a 14-year-old's knee before transporting him. And you could hear it throughout the whole yard. Like it, oh, it sounds like a gunshot.
You know, I told the daughter, I told her to take a break. You know, to prioritize herself, and I didn't think that she was gonna dump her mom.
Didn't realize the break was now.
Nick Valley cerebral perfusion studies back.
No blood flow past the brainstem. Okay. Let me know when the transplant people from court arrive.
Because they can use his organs.
Yep.
Let's go this way.
Okay, take him somewhere else entirely. Okay. Damn, that's not a good sign.
Unfortunately, it shows that there's no blood flow to Nick's brain.
What am I looking at?
It might help you if I showed you. This is a healthy brain. See the black? That's blood flowing to the cerebrum.
He's brain dead.
I am so very sorry.
I prayed. I had hope.
We all did.
What happens now? He's hooked up to all those machines.
Take some time. Try to process this news.
Thank you.
Her rosary beads and everything. Just praying so hard.
How'd it go?
Oh, it never gets easier.
Is that Dr. Robbie? You owe me a dance.
Boost your patient satisfaction.
Ready?
I doubt that she's gonna be the one filling out the. No.
From a show perspective, it's a nice way to give a little elevation from the scene you just had.
Yeah.
You, follow me.
Joey, new shoes.
She was so excited to do a chest tube all day.
Should I draw your blood? You already did. I'll have Dana do it after the wound repair.
It's not too
Can I
bad.
suture for you? Hell no, I'll do it myself.
Hell no.
1% Lido with epi, 5cc syringe, 27 gauge needle.
No.
So fast too. But she already kind of knows everything that you need, so that's why when it comes out that fast, it's like, okay, I just know your preferences as well.
Think mom will consent to Christy terminating the pregnancy?
A woman should only have a child if she wants to.
So she does have that kind of thought. It was just a legality issue before, I guess.
Yeah.
I need a doctor in triage ASAP.
What's up?
Have a teen with severe scrotal pain and need a raw torsion.
Pull 4 of intranasal Versed. I got this.
Be my guest.
Torsion of their testicles?
I'm Dr. Heather Collins, and I take it this is Dylan. And I'm his mother, Tina. It's nice to meet you both.
He's like, just hurry this up. Ugh.
I need to do an ultrasound to make sure your testicle didn't twist on itself and cut off the blood supply. Is that all right with you?
I'm always worried about that.
We're going to squirt some medicine up your nose. It'll help you relax and help take away some of the pain.
And do it.
Okay, Dr. Collins says it'll help.
I know, Mom. I heard her. My ears are fine. It's my junk that's killing me.
It's my junk that's killing me. Oh.
It's not a needle.
Yeah, I know.
Oh, good, doctor.
Oh, he's still here cleaning.
If it goes untreated for more than 6 hours, he could lose a testicle.
Shit.
I can lose my balls.
Just one.
One testicle. What the hell were you doing, Dylan? I'm taking that lock off your door.
This mom cracks me up. What type of plane?
Well, no, I've heard stories of like guys sleeping and like if you sleep with like boxers or no underwear or anything like that, like in turning and rolling over during the night, them twisting up. I don't want to so worry about that.
Oh, I know. Like, and it's so hard. Like, you have to have an ultrasound for this situation. Like, we've had, like, an inmates, like, before complaining about severe pain, and you can't palpitate it. Like, you can't, like, feel if it's twisted or not. So, like, you do the best you can, and then you're like, oh, they look like they're actually in pain. I can't do anything here, because I'm not going to twist it the same way again or anything, you know? So you just gotta send them out. But
okay.
Yeah.
All right.
I can't imagine. Like, I mean, of course, I don't have them to empathize, but I can only imagine the pain. Like, I don't.
Yeah. I don't know. Keep them close.
Don't keep them separated.
What? No. They keep them separated. That's what causes it. When you get anyway.
Gotta take that lock off your door.
Forearm x-rays are back on Mr. Ofori in the south corridor. You can discharge with a volar splint. Notify ortho. ADF.
Always discharge first. Got it?
Yep. Discharge before you start a new project.
You want me to pad my chart?
No, I want you to show your work. Billing is a side effect of that. Did anyone listen to what I said earlier?
So we rotate outward by opening the book.
Testicle might have twisted out of the way.
Let's go back 180. Another 180.
I'm okay now.
It's fixed. For the time being, we need to admit to urology. He'll need minor surgery to tack it down and prevent it from happening again.
To tack it down.
Oh, that means like sutures in the balls, right? I don't know. I don't know how they tack it down.
Please let me know when you get your own office because you have been wonderful.
She really likes her.
Hey, I've been in triage. What's the update on Insel Kid's mom?
Please don't refer to her that way.
I'm ready to get law enforcement involved whenever you are.
He's not here. He could be out there.
I'm not ready to
Another
run kid's
ethical
life over a
debate.
thought crime.
We just need to make sure that
Okay,
he's not...
okay, I get it.
We should admit her.
She's recovered.
She's good physically, but she made herself sick to get her son here. She's clearly not coping and she needs professional help.
There's so much ethics in medical care.
Yeah.
It's a parasite in your brain.
Oh shit! What?
A worm. In my fucking head. Are you kidding me?
You don't have a worm in your head.
You just said that I have.
I said you had a worm in your head, but it's dead and long gone.
That would be you as a patient.
Nuh-uh.
Yeah.
Is my brain like Swiss cheese? Am I dying?
No, you're not
No,
dying.
Joseph, you're gonna be okay.
Can you fix it?
Unfortunately,
why did
no.
he have a seizure?
The little calcified spots will stay there.
So there's going to be a worm graveyard in my brain forever.
But
That's
they're
excellent.
resting in peace.
A worm graveyard.
One of us is always sad since my husband died.
Would you be willing to speak to a behavioral health specialist?
I don't need that.
Devastating personal loss can be very hard to manage on your own. It might even improve your communication with David.
Okay.
Great. They can get you in to see a psychologist at 1:30.
Today?
In an hour.
Okay.
Great.
Were you able to come to a decision?
Chrissy's gonna stay in school until she's due.
Is that what you want? Let me get you some anti-nausea medicine. It'll help you feel better, and you've got a long drive ahead of you.
Okay, fine. I never did meds, but sure.
What a bitch.
Nah.
Is it serious? He broke a few ribs on his right side from the fall, which caused some bleeding around the lung, so he has a drainage catheter in his chest. His condition is serious, but it's stable now. Would you like to go see him? He won't be able to talk with a breathing tube in, but
Yeah,
no,
where is
we'll
he?
wait in the waiting room.
A little blunt, but not too bad.
We will find you with any updates. Thanks.
Maybe she doesn't want her to see her dad like that kind of thing. I know sometimes people talk about like it can be hard to show kids when someone looks whatever.
Yeah, you don't want that to be like your last memory or anything.
I have a dependent patient whose daughter might have ditched her.
I don't always get to see the best side of people.
I guess it just kind of makes me sad.
It is sad.
I don't really know what to tell her about her daughter.
Well, you don't have to have all the answers. Sometimes just asking how someone's doing is enough.
I love Dana.
Will Miles be able to walk again?
And look away.
Yes. He will
Like,
recover.
does that one not bother you? You handled it so well.
They're a little different than hypodermics.
Is there anything more you can tell me about the parents?
Lily and John Bradley, middle class, college educated, Catholic.
How's her demeanor?
About what you'd expect. Nick was their only child.
You?
Doctor, can you stay? Please.
Sure. Happy to be here.
There's no blood going in Nick's brain. He's brain dead. So he's dead.
He was the quietest baby. He slept through the night. It was perfect. I can't believe this is happening.
I know how difficult this must be for you.
Can you tell us what happens now?
Yes, I can walk you through all the next steps.
So sad.
Fuck it. I dropped a scalpel and it stuck into Garcia's foot.
Oh, that's bad. It might actually be worse than fainting.
Might be worse than...
Killed a patient?
Not really.
You kind of did. I'm sorry you did.
Jeez.
He wasn't fully...
Just because you dropped a scalpel, man, doesn't mean you have to do this.
His name was Bennett.
Oh, great. You can get his name tattooed on your chest. At least I'm not the only fuck up here.
Has to be everyone else's fault, too.
I think we should talk about something else that is very important. Your son's driver's license indicated that he wanted to be an organ and tissue donor upon death.
No, he was too young to make that kind of decision.
I can understand why you would think that, but he was 18.
No! He is still my son!
Sorry.
Silas's chest tube output is slowed down after 650 cc's.
Good.
But on re-exam, I noticed some breast enlargement, bilateral and symmetrical with no palpable masses.
So what do you want to check?
LFTs for alcohol abuse, and for the rest, hormonal levels, estrogen, testosterone, prolactin, HCG, progesterone.
Good. Go.
I don't know what they said.
Liver function tests, hormone tests, just to look for what's going on, why his breasts are enlarging.
Who do we have to thank?
I don't know. I think there's a card by my back.
Enjoy your lunch.
Who was it?
What? It's from Shelby Adams, from Dr. Adams' sister. She sends something every year.
He doesn't like her?
It's not about her. It's about him.
There's free lunch in the lounge. Do you need to take care of that?
I do. I just, I want to check on a patient first. But thank you. Jesse.
It's their first day, right?
Yeah.
You're gonna forget people's names.
He didn't seem too offended, just... let down.
Can I do something for you while we wait?
I wouldn't mind a snack.
I can have someone bring you a sandwich.
Wonderful. Feel free to bring that Dr. Robbie back around too.
Bring that Dr. Robbie back.
He's so sweet with her, though.
Mel!
How was lunch?
It was good. We had paninis and watermelon salad.
That sounds delicious.
Have you found a boyfriend yet?
No.
Hurry up, you have to find somebody to kiss.
You're right, I do. I gotta get on that right away.
Oh, she didn't go into the trash and get the meds back out. Oh. That wasn't the same trash can, right?
Well, now she's in the restroom.
Oh, I want the pill!
Absolutely not.
Eloise, why didn't you find a place to sit and
You're gonna what? Give my daughter the abortion I forbidden?
Hey,
what's going on?
Lynette, I got this. Come on.
You are treating Christy like Mom treated you. Fuck you.
Hey, let's take it down
This
a notch.
is none of your business. I am not abandoning Christy. Get the fuck out of here.
That's enough!
Damn it, we're over again?
Well, we know where the ambulance is. That's all I wrote down.
Yeah, we know that. Theresa, the mom of David, is going to have a psychologist in the middle of next episode, supposedly. Because this was like 12 to 1.
And he was like in the next hour, right?
Mm-hmm.
Or at 1. What
1:30.
did he say? 1:30.
So I don't know what's going to happen with that. I don't know what to expect with all the things with what's going with that. I just keep waiting for something with it. But maybe not. Like, there's been some people that come in and it's just like a take care of issue, and it's just kind of representing something that hospitals have to deal with. So maybe it doesn't deal with that. Maybe it does. I don't know. I've enjoyed them having the moments where they get to discharge people, because like they have elements of like, look, here are some quick and easy ones. You're gonna have this in the ER, and then here's like the big issues. You're gonna have those in the ER, and like we do focus on the big issues, but then we still have like Ginger is an entirely different issue, but she was a quick fix. You know what I mean? As far as like she came in with her arm, they took care of that, and she's discharged and ready to go. But then they couple that with the ADL, like, right? Is that what it's called?
Activity of daily living?
Yeah.
Activities of daily living?
Yeah, like her, like, assisted living kind of stuff with her daughter and all that stuff, and what kind of stuff she's getting taken care of, and then, like, the abortion one coming in where it's like, well, that one's not like a big, like, it's not like the kid coming in with, like, you gotta pull his clavicle back out so he can breathe, and we gotta do all this stuff. Like, there's simpler ER issues that they're taking care of, but those ones seem to be coupled with like more ethical questions, I think, than they are like emergency questions.
Right.
You know what I mean?
So I think that's why the show does such a great job, like demonstrating things that do go on. Like you do have like your staff drama, like you do have the new doctor being like, well, you all suck too. You know, like you still have a little bit of tension between, but then you still work together as a group. And you work together as a group whenever it comes to like traumas, and they have good traumas demonstrated. They have good like fast track things. Jeez. Right? Good fast track cases where it's just in and out, and like you said, people are getting discharged. We are working and prioritizing the discharge. We are also dealing with administration. And like administration's always up your butt trying to be like, hey, you make sure that your patient satisfaction rate is good, because that is a thing that people have to deal with. It's annoying because you're like, this is the ED. We should not have to focus on that.
The ED is, what's ED?
Emergency department.
Okay.
And
Not
then
just ER, okay.
And then because it's not just one room, it's a whole department.
Sure.
They went through a huge thing. Anyway.
So if they made that show today, it would be called ED.
Erectile dysfunction. But then we also have all the ethical cases, like you mentioned, that like doctors have to think twice about what they are doing. We have the two big ones where should we call the cops on this teenage boy? He's not currently a patient, but he might be doing something wrong. But we can't do anything about it. He's not ours.
Yeah.
And then you also have the abortion one.
And they don't know where he is. He didn't show up to school, none of that. You have the ethical debate over the abortion side of things, where this teenage girl doesn't want to be a teenage mom.
So you have all these different components working together, and it does demonstrate the emergency department well.
There was that moment where it's like you're trying to treat her like mom treated you. So I'm wondering, like, is there she got pregnant young and her mom was like, no, you are not getting an abortion. And she's like, well, I couldn't get an abortion, so neither can you, kind of thing. You got to live with your mistake.
I didn't take morning sickness pills.
That was one thing, too, where it's like, I didn't have meds. And I was like,
not everyone has to be you. Congratulations. Did you get a trophy for it? No. Like, what a bitch.
And then we had a scalpel in the foot. That thing sucked.
Yeah,
They did cover some of the things I talked about. I think it was last episode when he got like blood on his face, and I was like, "What do they do for that?" And then you talked about scalpels and needles and that kind of stuff, and we went directly into that one this time with like cutting and then straight in. And they talk about labs and testing to see. Like,
yeah, well, that's because it was blood to blood transfer for sure that time.
It just related to that question that I asked last time.
Yeah,
and I was
exactly.
like, oh, hey, now we get the actual, like, the same situation.
And I love Garcia's interaction there. Like, whenever the student was like, should I draw your blood? And then she's like, you already drew my blood, because she cut her foot open and drew blood. Like, I was like, oh, at least she's, being funny about it. And she's not being hateful.
Mm-hmm.
She's just like, learn. There's a difference between confidence and cockiness.
There is. And I hate how she, like, because she made a mistake, she then had to start pointing out everyone else's mistakes, given that they kind of pushed back against her, because she'd be like, hey, Crash, hey, Huckle. Like, she's been giving them nicknames and stuff with that. And it's like, that sounds like a much bigger issue than feigning.
Yeah.
And I'm like, yeah, they're right, but, like, you've been dishing this out, and now when this happens, like, oh, at least I didn't kill a guy. And I'm like...
She can't take it.
Yeah.
Yeah, she can serve, but can't take it.
There's just a bit of, like, that cockiness, I don't know, perhaps an element of narcissism, I'm not sure what it is, where it's like she always feels she's right, so she's always going above. Like that thing about going to the resident, or going over the resident.
Going over the resident to the attending.
Yeah, like just doing stuff like that where she thinks that she's always in the right, and then she made a mistake. But maybe she caught something for this guy with the enlarged breast or whatever that's going on.
So running some laps on him.
But I mean, that's good. Not to say that she's not like she's a bad doctor, but I think that she could tone down some of that and be a little bit more like, I don't know, sympathetic and empathetic.
Oh yeah, for sure. And her bedside manner with like the family isn't too horrible. It's just the way that she treats her colleagues.
Sure.
So.
And then we had a moment with Dr. King. I think it's Mel King.
Yeah, Melissa. Yeah,
talking with her sister, kind of relating to. She talked about her being the primary caretaker for her sister, similar to the lady and her mom, and I think similar to the abortion side of things, she's hitting that personal note, just like Dr. Collins is hitting that personal note with the baby and stuff. I was getting worried that those two, the sisters, were going to start fighting, and hurt Dr. Collins, and she was going to end up losing her baby, which would be...
They get shoved, right?
Sure. But the irony of dealing with an abortion issue here in the ER to then lose her baby from that, like, I wasn't sure if that's what was going to happen.
Yeah, that's why, like, even you mentioned, like, first episode or whatever, isn't it good to let the rest of your colleagues know if you're pregnant or not? Like, shouldn't they know? Yeah, sometimes it's really good for everyone, like, on your team to know, so then you can keep her safe. Like, Dr. Collins should not go into the Kraken, but Dana knows that.
Yeah.
And that's why Collins did not go.
Sure.
Like, you should not be put in those situations.
But maybe don't put her on the abortion one, maybe, or something, too. But, I mean, maybe not. Maybe there's...
took that one.
Yeah, maybe it's fine to do that, too. It also, like, she had this episode where she's like, a woman should only give birth if she wants to. Like, one of those kind of things. And I'm like, okay, that kind of, like, couples with, like, last episode better, where, like, she was more concerned with the legality and it coming back to hurt her, even if she thought, like, we should do this because the patient wants it. It felt like, I don't want to lose my job over this.
Yeah.
So she comes to Robbie, and she's like, I'm not wanting to tell Robbie, you do this. But you're in less danger of losing everything than I am. So that's kind of, I think, where she was with all
because I believe she's still a resident. She's not an attending yet. So she's still, like, that's why, well, she even said that Robbie has his tenure, right?
Yeah, I think so.
So he definitely has a lot more protections than her.
Were they talking about the one doctor moving up as like an attending, or would they talk about? There was something with some kind of school thing, I guess maybe is what it was, but it sounded like some kind of promotion for the one guy, the guy that's kind of cocky as well. Are you mad at Are you mean to everyone or just mean to me? Just you. I can't even say it right now.
Lipscomb, something like that.
Langford. What?
Is it?
What, you think I just made it up?
Yeah, I don't think it's Langford. Langdon.
I was close then.
Langdon.
Yeah, Langdon sounds right.
Yeah, I know. This goes by so fast. I feel like I don't get a chance to like memorize their names, but I'm not good at names and faces.
Yeah,
so.
I mess up names a lot too, but similar to, what was it, Dr. King, who was like, Jesse?
Yeah.
Like that moment, and I'm like, it's like the first day.
And then,
know?
and Jesse wasn't like
It's
a
gonna
douche
happen.
about it or anything. Like,
It didn't seem like it, no.
No, he's like, Jesse. He just felt a little let down because they had worked on several cases together already. But then it's like, oh, man, I thought I made a good impression. But, no. And then now because that awkward moment, I probably will not forget Jesse's name. Just because, like, whenever something cringy like that happens, that stays.
I get you. I mean, it was really sweet that Mrs. Adamson, like Dr. Adamson's like wife, every anniversary.
Sister, but yeah.
Sister, that's what it was, okay. Sends that in to them. I thought it was really sweet. Made me think. I haven't often thought about like people just being like, I'm just going to send this to the hospital. Did that happen very often in the ER of like just food just showing up or anything?
Sometimes, yeah. And I complain about working day shift a lot because of administration, but that's whenever food would come in, like thank you gifts or
Not
like
during the night shift.
No, we'd get like leftovers.
We
But
should order pizza and have it delivered at like, I don't know what night shift starts, but like 11 p.m.
But yeah, as memorial or like thank you or local shops just donating, you know.
I remember hearing about it during like COVID times when it was so stressed and like they were so taxed with staff and shortages and how often did you say you get to eat at the ER? Like that's what they talk about, right? He's like, it's noon. Do I get a lunch break? It's like
you don't get a scheduled lunch break, that's for sure.
Here's a snack, and you can grab a sandwich from the cart.
Actually, I think because so it's over now. There was a lawsuit because we did not get lunches. So there was a pretty large lawsuit after I stopped working there, and just so then people could get lunch and get compensated for the hours that they did not get to go out on lunch. But then I think after I left, I was talking to some of the ex-friends, friends that still work there, and they were saying that they were now like scheduling kind of lunches, like, okay, you'll get first round, you'll get second round, like, and actually
not everyone goes at the same time, but
yeah,
like there,
not.
you get one now. When you come back, you go. When you come
you were
back,
the first one here, you go first, and like they would try to organize it a little bit better, and they were starting to prioritize it. Also, they were a lot more stricter. You could not eat at the nurse's station like we used to eat at the nurse's station.
Oh, it's probably the only time you had just
exactly. You would
eat
just
and go,
shove
right?
and go. Yeah, so like our specimens would be there at the station and whatnot, and then we're just chowing down while we're charting.
I guess if
like,
they're giving you some time, you can be more like, you can't eat here, and it's also more encouraging of like, you go do lunch.
Yeah. But then your break room, like you could not, like whenever I worked on the floor, I actually got a lunch period where I could go walk, like outside or something and not have to be there to answer to calls, versus in the ED, like we would have to keep our lunch there. Like we would have to be close by in case a trauma comes in.
Sure. You can't control whenever like a flood of anything happens.
But that's why, like, in this episode, they were really good about it, announcing the traumas and the strokes and anything
Well, and they're
else.
ahead of it a lot, too. They're like, 5 minutes out, we got this coming in, and they're doing that kind of stuff.
Well,
which
over the intercom.
Oh, sure,
Like,
okay.
over the speakers. So that's very important in case you are grabbing lunch and that you are not there on that floor. Like, if you are far away, it announces to the whole hospital. So that way you know that you need to respond. You need to go back.
Gotcha.
Because there's been times I was holding a salad, like, ready to get it weighed and everything to buy it, and then they would call the trauma, and then it's like, oh, unfortunately.
You take this.
Yeah. It's like, I'll be back for that. Oh, okay.
Okay. All right. Well, I'm interested to see what happens with Theresa, if that continues to be a big story plot, or it's more just trying to take care of her and see if that. I mean, I did like the idea of like the psychologist. Maybe that stuff could help her communicate with her son. The abortion stuff, I'm curious to see, and then we just have like some other ones around that are like, I wonder where they're going with this. What's going to happen?
Well,
with
we
that.
also have the counselor situation, which is another good representation of what goes on, especially with
the
trying to get the
son's
organ donation. So, with all of that and helping the family there.
Sure. And I understand, like, she hasn't processed it yet. I mean, different religions are going to look at, like, what they can do with their body differently and stuff, I suppose, too. My thought is, like, I'm not going to use anything, so if any of my stuff's good to help someone else, then go ahead and take it, you know?
Yeah.
Like, what do I need my heart for? You know, if I'm dead or something, so.
Yeah. I mean, like you said, there are some cultures that believe that you go up all intact and stuff, so.
So.
But, yeah.
But like that one conversation where it's like he was too young to understand that. It's like he was 18, he was an adult.
Yeah, the counselor handled that well.
Yeah. So I'm waiting to see that one too, as far as like them kind of like coming around a little bit more, having a little bit more time to process and deal with it. Father, I think too, also was kind of like his sorry felt like, I know that was a lot right there. Let me go talk with her and work her through it and see where we're at.
Yeah.
Can they say no to the organ donating? Or because he's an adult and he had it, like, the hospital can just do it? You know what I mean? Like, I don't know what the legality of that is, or if you have any idea. That's not necessarily your department that you would have covered or anything, but...
No, but we had to deal with it. But, I'm pretty sure they still go through with it, but they want to make sure that the parents are aware. But he has the signed papers, because whenever you get your driver's license, you can say yes or no, right?
Yeah, so that's when he would have...
But I don't think that is legally binding, if I remember
If
correctly.
they go through with it, do they just, like, send them upstairs and they just start taking out organs now, or what? Because, like...
They don't send them upstairs.
They just do it right there, though? Like...
Well, I guess it really depends on what all they are harvesting, but...
Because, like, if you wait too long, like, once you take them off the machines, like, the body's going to deteriorate. And then some things, I think, like, you only get so long before, like,
yeah, but he's still on life support. Like, he's...
I know. What I'm saying is, like, what's the process of that, though? Do they just... it must be in the hospital. They just send you somewhere, start taking things out, like, that day?
Yeah. Like, as soon as they are pronounced dead. And they have to be pronounced dead before they can start harvesting. So, like, even after you take them off the vent and everything, their heartbeat has to stop. It has to be declared dead.
Even with the brain dead aspect of it, they still need the heart to stop first?
Yes.
And, like, the minutes or whatever, you got to listen to make sure that... Because we had that with the dad, the older gentleman.
Oh, yeah.
Okay.
To declare, yeah. So you have to wait for that before you can begin the harvesting.
Okay. All right.
The procuring. I guess that's a better word than harvest.
Procuring of organs, not the harvesting of organs. All right. Did you have anything else?
I seriously only wrote ambulance.
Dude, that moment, though, like, it was a dumb thing to do, but I did kind of like that the kid was, like, you know, he's kind of picked on, no one really likes him. I thought this would be kind of a way to, like, up his cred, you know? But...
in a weird way, it's very sweet. I agreed with her.
Yeah, she's like, that's actually kind of sweet, but it also was dumb.
But it is also, they did not, like, hurt anyone. There were no bystanders that were injured. So it would therefore be up to the city if they wanted to press charges, or whoever owns that ambulance. I assume it's a city
hospital
ambulance.
or the city, one of the two, whatever it is.
Or usually a lot of private ambulance companies.
Do you often have, or is it fairly common to be like, I'm working on this patient and the cop stands right there? Because, like, during that part, there was a cop just, like, standing over their shoulders. Like, just...
Oh, yeah, he's arrested right now.
Yeah.
So, yeah, the
but,
cops
like, they stay there the whole time?
Yeah. because now technically they are in their custody. So if that person does anything, it's on the city, it's on the cop, their jurisdiction. And so their fault.
Okay.
So you always stay in the room, yeah.
Okay. Alrighty. Well, that's all I have. So, guys, we will be back next week with another episode. Make sure you subscribe. We'll see you guys next time. And don't forget that there is early access over at blindwave.com. You can see up to the next 4 episodes. Full length is a little different than other ones because of us doing the pausing thing, but that should also be over there. And also, if you're enjoying this and you like this format, let us know. Let us know down in the comments or hit the like button. So, see you guys next time.